Well, my friends, this is a rare disease, a rare bone disease known as Eagle syndrome. It is very rare. The disease is nothing but the ossification, extra ossification of the steroid process of mandible. So there is sharp pain, sometimes neuralgic and sharp pains. যেখানে where there is ossification, condyle, epicondyle lodges. When the epicondyle is enlarges, it gives pressure of the nerve root, so pain appears. So it appears at the condyles of the mandible. It is called Eagle syndrome. This gentle lady, aged about 42 years, has come from Allahabad of Uttar Pradesh, UP. From UP, they have come to treat this Eagle syndrome. 1.5 centimeter of bone is already enlarged or elongated, that's the condyles.
4.3 centimeter.
That is about 4.3 centimeters.
Left side.
There is bilateral tips of the steroid process are ossified and reaching up to the lateral walls of the oropharynx. And this is known as Eagle syndrome. Eagle was who was Eagle? Why the name is Eagle? Eagle was an otolaryngologist of the Duke University who first introduced this disease in 1937. It is a rare condition caused by an elongated or disfigured of the steroid process. And this disfigured or ossified extra bony growth interferes with the functions of the neighboring structures and gives rise to orofacial and cervical pain. সামনে ব্যথা হতে পারে, the pain may refer to the back, often triggered by neck movements. So this is a rare disease, then the patients are very rare. I have cured many cases. In allopathy or modern science, that is only operative process, and the process is not very successive. Many physicians, many surgeons are failed to perform these operations. So someone may live with Eagle syndrome, but with sharp and sudden nerve pain in the neck, in the throat, in the tongue, in the mouth, and in the face. Additional symptoms can include difficulty in swallowing, changes in the speech, headache, tinnitus, the sensation of something stuck in the throat, and pain when turning the head on while chewing. So this is Eagle syndrome. But to me, in homeopathy, now the question arises, is the Eagle syndrome is fatal? Eagle syndrome cannot be frustrating and fatal. It making only painful, pain during talking, pain during eating, or even turning the head sidewise. A person with this condition may worry that something is seriously wrong and happening, but Eagle syndrome is treatable with excellent outcome for most people who seek treatment in our homeopathic treatment. So, Eagle syndrome. But we homeopaths always look after the patient, not the disease. Whether because there may be name Eagle syndrome or any other syndrome, but the disease is ossification, that is extra bony growth, which is nothing but the Hahnemann's theory of myasm is psychosis. Where there is extra growth, that is psychosis. So one antipsychotic medicine may be required, and considering the patient's physical makeup, obesity, and the mild temperament, etc., I have prescribed and obesity, physical makeup, mildness, gentle yielding disposition, I have prescribed acetyl nigricans in 50 millisieverts of potency once daily morning, and let's see the result. I am dead sure the patient will improve because already 2 or 3 cases improved, and those patients are referred to them. You have heard from the version of that patient that they have cured, and that's why you have come.
Yes, sir.
So, my experience tells, as I already cured some patients, this gentle lady also will be cured. Thank you very much for your kind cooperation, madam.